Okay. Good morning, afternoon, or night, everyone, and thank you for joining us. We're excited to welcome participants from across Africa, Europe, and beyond to this session on early career medical physics, a field that it is essential to strengthening cancer care, diagnostic imaging, and nuclear medicine worldwide. Today's discussion is all about learning from each other, sharing practical experiences, and exploring how collaboration between our regions can support the next generation of medical physicists. So, to guide us through today's journey, here is a quick overview of our program, which moves from opening reflections to professional experiences, followed by an interactive Q&A, and finally, our closing remarks. So, before we go to the closing remarks, let me introduce both of our great speakers and part of the team today. So, let me just share part of their academic and career journey. Edwin Kagai is a dedicated radiation and environmental physics final year student at Kenyatta University and the Secretary General of Radiation Protection and Nuclear Safety Youth Network. He is also the Kenyan representative to the International Radiation Protection Association Young Generation Network, serving as secretary, and he is passionate about radiation protection, nuclear safety advocacy, and empowering young people to actively shape the future of nuclear science and technology. Edwin Kagai is passionate about combining his studies with community initiatives to inspire youth involvement in science and safety. And we also have Matteo Baldoni, who is a communication and project manager at the European Society, which promotes the development of nuclear science and technology and the understanding of peaceful nuclear applications. Based in Brussels, the European Nuclear Society brings together more than 12,000 professionals from the academic world, research centers, industry, and authorities. So, Mattia and Edwin, please over to you. Thank you.
Thank you, Florencia. Maybe a few words introducing, welcoming everybody to this new session. I would like to share my great appreciation for this second episode, actually, of this mini-series we have been able to organize together with the collaboration with the African Young Generation Societies, with the Radiation Protection Nuclear Society Young Generation, and our speakers, I think, insisting that the mutual exchange across continents is definitely a great experience, and doing that by exploring the different nuclear fields, it's even more inspiring. And today is the time for medical physics, so to explore how nuclear science and technology application brings benefits to human health. And to discover how different application and innovation in the sector can really help millions of people worldwide. So I will let, of course, the stage to explore more to our speakers. Just again, thank you and welcome on behalf of the RPNS-YN initiative.
Wonderful. Thank you so much, Mattia. We really appreciate your words. And now I'd like to call for Edwin, if he can give us some remarks about RPNS-YN and the organization. Please, Edwin, over to you. Yes, we can hear you very well.
Okay, thank you very much, Florencia, for this amazing introduction. Good morning, good afternoon, good evening, everyone, depending on where you are joining us from. It is my pleasure to welcome you to today's RPNS-YN webinar, From Training to Practice, Early Career Medical Physics in Africa and Europe. I am truly honored to witness young professionals from Africa and Europe coming together to discuss this amazing transition from training to practice of medical knowledge. I believe medical physics plays a very important role in ensuring patient safety, radiation protection, and quality assurance in healthcare. However, I know the training from classroom to actual work in the workplace of medical physics is not always straightforward, and that's why we organized today's amazing platform so that we can share our experiences, we identify the challenges, and explore practical pathways that are going to help the early career professionals, and even the students that are intending to join this career pathway. I wish to thank everyone who is taking part in this collaboration that is given by these amazing discussions, from a single email to an actual webinar like the one that we have. So RPNS and RPNS-YN, they are very grateful to have everyone on board. Now, ladies and gentlemen, I wish to stop there and please study to the end. You wait until there is photo session. You feel free to exchange contacts and ask any questions about this topic. Thank you very much, everyone. Back to you,
Thank you.
Florencia.
Thank you very much, Edwin. Sorry about the difficulties with the noise background, but we really appreciate your great speech. It has been tremendously valuable. Um, so now I would like to give the floor to the professional ambition experiences. Today we have three wonderful speakers from Greece, Spain, and Zimbabwe. I would like to start first introducing some experience about our speakers. First of all, I would like to call to Ana Maria Fano from Greece. She's currently based in Sweden and works as an application and physics specialist at research laboratories in Stockholm. She has a medical physics background and she comes from Greece. She's also a member of the steering committee of the Early Career Medical Physics a special interest group SIG in European Federation of Organizations for Medical Physics, IFOM. With Ana Maria, we also have an additional guest, Mrs. Leticia Arazola. She's also from Spain, and she's a PhD in medical physics, currently a postdoc at Hospital Universitario San Pedro, and she's a professor assistant at the same university and also an important member of the steering committee of the Early Career Medical Physics Special Interest Groups in the European Federation of Organizations for Medical Physics, IFOM. So please, Ana Maria and Leticia, I would like to give you the floor to start your presentation. Thank you so much and welcome today.
Yeah, thank you, Florencia, for your very kind introduction. So Leticia will start, since she's the governor of the Early Career Medical Physicists Special Interest Group in IFOM. She will start with introducing herself, and then I will take over and proceed with my presentation. So Leticia, whenever you feel ready, you can start.
So thank you very much. As Ana Maria said, I'm the governor of the IFOM Early Career Special Interest Group. I'm so glad to be invited here, me and Ana Maria, as the representative of this group. We are a full group of people from all around Europe that we work to put the early career in a position for the future. So for us, it's a pleasure to share these experiences of being early career, being new, being medical physics all around the world. So I think this initiative is really great, and we are glad to hear about the African Society and to hear all what you have to say to start some kind of cooperation and to establish a network between both of us. So I let Ana Maria explain all of our group, and thank you very much for inviting us and being here.
Okay, I'm not sure if you can see my screen.
I guess just the full cover slides, and then I think we're ready to go, Ana Maria.
Okay.
Perfect.
All right. My name is Ana Maria Fanu, and I am a member of the Early Career Medical Physicists Special Interest Group. And today I'm going to talk about medical physics in Europe through an early career lens. And again, I'm representing IFOM and not research laboratories during this webinar. So IFOM, as you can see here in the slide, stands for European Federation of Organizations for Medical Physics. It was founded in May 1980s in London, and it serves as an umbrella organization for all the national member organizations that belong to that. And the motto is that we're trying to apply physics to healthcare for the benefit of patients, staff, public, planet, and beyond. So you can imagine, you can think of IFOMP as an umbrella that includes all these special interest groups that you can see here. And each special interest group has a specific topic, as you can see. So we have special interest groups focus on a special interest group focused on particle therapy, for example. Other ones focused on AI, on MRI, and so on. And in each of these special interest groups, there are medical physicists as members of these groups. Today I'm going to focus on the work that we're doing in the Early Career Medical Physicists SIG, since I am a member of this. And all of these special interest groups are, again, belong to the FOMS umbrella, and they are getting assistance from the relevant FOMS committees. So about the Early Career, as I said, it was founded in December 2022. And what was our purpose? Our purpose was to represent individuals with less than 10 years of experience working as medical physicist professionals across Europe. But why do we need this special interest group? Our intention was to give a voice to all those early career medical physicists working in Europe and want to develop their profession and inside the IFOMS sphere. And for those also who would like to connect with other early career medical physicists and grow their network and feel seen. And the third reason why we established this group with IFOMP was for the early career professionals to develop not only their scientific skills, but also their soft skills, such as communication skills or strategic planning and so on. About our activities, we did an attempt to try to gather information about the medical physics training and also about how to obtain the specialization or the certification or license in medical physics in its European country. So therefore, we conducted a survey in July 2024. We distributed a questionnaire to our members, and we asked for their answers to some questions. And the overall goal was to try to find out how it is possible to become a medical physics expert in its of the European countries that are members of IFOMP. And now I will start with one example. So this example is Albania. So if you want to become a medical physicist in Albania, you need to have a bachelor's degree in physics. And there is also a master's degree that you need to obtain. And the accredited program is the one associated with the Polytechnic University of Tirana. As you can see here, the areas of expertise that you can get is nuclear medicine, diagnostic radiology, and radiation therapy. In order to obtain the medical physics license or the certification, you need the training and 2 years of experience. About the residency, the clinical training that we typically do before obtaining the license, there is no specific structured program in Albania. And as you can see, there is also no salary since there is no clinical structure program available. And now I will walk you through another example. So this is Spain, as you can see here. So about the qualifications for the bachelor's, as you can see, they accept any science related. There is no accredited master's program. The areas of expertise that you can get is nuclear medicine, diagnostic radiology, radiation protection, and radiation therapy. So compared to Albania, they are involved in radiation protection as an extra. And then in order to get their medical physics license or certification, they have to go through 3 years of residency or clinical training, and they also need to pass an exam. In order to access the residency program, they have to pass a national exam. And the structure of the residency program is through this national scheme that they have. But it's also dependent on the hospital. And as you can see, they get salary during residency. Of course, I don't need to go through every European country, but just the take-home message is that the qualifications that you need in order to obtain this medical physics license or specialization or certification, however you want to call it, across the different European countries is different. And then if you are interested in learning more details about this, then you can scan this QR code that you can see here. And then you will be redirected to IFOM's webpage referring to medical physics training. And then if you press this Europe interactive map, then you can download the PowerPoint, including information about the qualifications that you need in order to become a medical physicist in every European country that is a member of IFOM. But keep in mind that these data, again, were obtained through this questionnaire, and that this happened in July 2024. So some data might be outdated. So it's always a good idea, if you are interested in learning more about this, to contact the National Association of Medical Physics in each European country. And you will find the information, contact info of the national associations in this webpage. So you get both of these things if you scan this QR code. About other activities that we are doing, we are actively participating in congresses and events. And we are also responsible for organizing the early career track in the ACMP, the European Congress of Medical Physics. And specifically, Letizia Rasola has done a great work on that. And here you can see some pictures from the ACMP early career track in Dublin, and a picture of my colleagues in the steering committee from the event in Munich. And the next ACMP is happening in Valencia in September 2026. So if you want to learn more info about this, feel free to scan this QR code that you can see here. About other activities, of course, we have a strong presence in social media, and we're trying to contribute and collaborate with IFOM's official social media accounts. We also have a WhatsApp channel to communicate with our members, and we are typically sharing with them information about upcoming conferences or interesting webinars that they might want to attend. And we also had a collaboration with RPNS-YN podcast from the European Nuclear Society called Powered by Passion. And now I will share a few more information about this. So as you can see here, Jesus and Nefeli were interviewed by Mattia Baldoni. Mattia is the communication and project manager at the European Nuclear Society. And they talked about their personal journey in the medical physics field, how they they started, what was their motivation, and what they have achieved so far. So if you're interested in learning more about this, feel free to scan this QR code. And the podcast is uploaded to Spotify and YouTube. About other activities, we have contributed to IFOM's mentorship program. Detailed information about this program you can find in this webpage, and you can access that by scanning the QR code. Yeah. this is the same QR code that I showed before. And now we'll try to briefly explain the purpose of and the structure of the mentorship program. So you can imagine that we have two groups of people, the mentors and the mentees. So the mentors are the ones that they have expertise and knowledge in a specific field, and they also have some availabilities and objectives that they would like to achieve. And then we have the mentees. They're typically early career medical physicists with also some areas of interest and some objectives, of course. So the idea is that we're doing a pairing process, and it starts. So we're basically trying to match the mentors and the mentees based on all the things that we discussed, the objectives, their interests, and also their availabilities, and so. Therefore, we schedule the interviews so that the mentors and the mentees will have the opportunity to meet each other and brainstorm and discuss. And then after the interviews, the pairs of mentors and mentees are created, and the mentorship program can start. And then there are also, throughout the mentorship program, and of course at the end, there are evaluation rounds in which the mentors and the mentees can share their thoughts and opinions about the program. And now I will talk about the collaborations that we have with other groups, which of course are very important. So the first one is with ECO, the European Cancer Organization. Another one is the YGN from ENS, so the Young Generation Network from the European Nuclear Society. And this webinar is the reason why I'm speaking to you right now. And of course, I'm very grateful for this opportunity. And then we recently started collaborating with the AAPM, the American Association of Physicists in Medicine. And in January, we organized a webinar based about bridging continents. So to discuss about the gaps that we have between Europe and North America and how we can collaborate. So if you are a medical physicist living in Africa and you would like to get closer to IFOM, there are many ways to do so. So these are just my suggestions and my thoughts. One thing that you can utilize is the individual associate membership. You can learn more about this by scanning the QR code. If you become an individual associate member, then you need to pay 15 euros per year. And you get access also to the IFOM's e-learning platform. And it includes content like, for example, recordings from previous conferences organized by IFOM. So it's a great source of getting knowledge about specific topics in the medical physics field. And the good thing is that it's not limited to Europeans. So it's a very good opportunity for you who live in Africa. And then once you become an individual associate member, you can also apply for membership for the early career medical physicists special interest group. And this is free of charge. And you can do this if you want to connect with other early careers working in the medical physics field in Europe. So feel free to scan the relevant QR codes to get more info about those. And yeah, just another note, if you wish to work as a medical physicist in a clinic in Europe, apart from the other qualifications that we already discussed, the scientific related ones, in most cases you would be expected to speak the local language, since you will be working, if you want to work in a clinical setting. So the language barrier is also something that you need to consider in that scenario. And now I think there was enough talking from my side. So I think that I would like to ask you to respond to this question. So the question is, if you are an early career medical physicist based in Africa, then would you be open to collaborating with IFOM's early career medical physics group? And you can answer by scanning the QR code. I will stop sharing my screen. I will let you answer. I will also try to put the QR code in the chat so that everyone can have access.
Yes, you can put it on the chat, Ana Maria.
Yeah, okay. And then, and I also have a second question, so I will put that on the chat. So then the second is about I put if you will be open, willing to collaborate, then how we can facilitate that collaboration. So yeah, here you can just find some of my ideas. So yeah, since this is a bit different from the previous one, you would need, apart from scanning the QR, you would need to enter your name, and you cannot proceed without entering your name. So you can just enter a letter, or it's not official. I'm not planning to monitor your names. And then you can just press join the game and answer this question. So yeah, we'll proceed now to the last slide. So of course, I would like to thank my colleagues in the steering committee, Antonio, Agnes, Leticia, Katrina, Jesus, and Nefeli, for their hard work and our great collaboration. Here on the bottom of the screen, you can also find my email. So if you have any follow-up questions based on what I presented to you today, you can reach out to me. And of course, thank you for your attention. And I will try to put the second QR code from the second question in the chat. So that's all I had.
Splendid. Thank you so much, Ana Maria. Thank you very much for sharing these tremendous details.
Thank you, Florencia. And I'm very eager to learn about what the next speaker has to say.
Okay, great. So let me now introduce Hazel from Zimbabwe. And when Hazel ends her presentation, then we can proceed with the Q&A, followed by Victoria. So now it's time for Hazel Rosani. Hazel recently obtained her medical physics degree from the University of Zimbabwe, and she's an early career clinical scientist passionate about the sustainable use of radiation and nuclear science in the diagnosis and treatment of cancer. In this capacity, she advocates for disarmament and arms control of nuclear weapons and currently collaborates with the British American Security Information Council, BASIC, under the Emerging Voices Network. Hazel believes that radiation and nuclear technologies can save lives. They are a beacon for hope in healthcare. And Hazel is an emerging young leader and recently received her professional leadership certification from Oxford University under the Global Peace Chain. One day she hopes to establish an organization that makes radiation and nuclear treatments accessible to many people in her home region of Zimbabwe. She aspires to pursue groundbreaking research that could earn a Nobel Prize in Physics in line with advancements in the use of radiation and nuclear technologies in healthcare. Ambitious and a firm believer that a girl can dream, Hazel is dedicated to making a difference. I really like her statements. So, ladies and gentlemen, please, I would like to welcome Hazel as well. Thank you very much, Hazel, for being here, and the floor is yours.
Good afternoon. It's raining so much here in Zimbabwe, and I'll just need someone to confirm if I'm audible.
You do, please. Go ahead.
Thank you. Share my screen. Okay, share. Okay, there we go. Good afternoon, good morning, good evening to everyone, wherever that you are. I'm Hazel, as explained, an early career physicist from Zimbabwe. And it's such an honor to be here today and to be given the opportunity to speak and share with you my perspective as an early career scientist. And I've chosen to give this presentation, True Tales of an Early Career Medical Physicist, from the perspective of Africa and Zimbabwe. And in short, throughout this presentation, we're going to be navigating scarcity through innovation, research, and community so that you can make it as a great physicist. So now let's talk about the in-between. How do we navigate the scarcity? The biggest question when you're coming from a low-income community is, how are you going to make use of this degree? And often at times you're equipped with the knowledge that makes you competent, but you don't have the platform to execute what's going on. So this is the part of the true tale that I'm sharing with you, that while graduating with these high-end degrees, feeling ready in the world, sometimes you just hit a wall. And to go through this, we're going to navigate the scarcity with point number 1, which is addressing the struggle. The struggle that we have, there's a gap between the clinical training and the formal post. That is the reality of many economic situations here in Africa. And the trap is, it then becomes so easy to let unemployment define your status of unproductivity. And the shift for us to become competent and a well-known physicist who are doing the job that they ought to do is to stop waiting for the title to define your professional value. Because already with the foundation of knowledge, we're saying that you have enough. Next, we're going to address research as a gateway to knowledge. And I like to call this the researcher's tale. We're essentially saying you have the knowledge, so that doesn't make you useless. The knowledge is like seeds that have been embedded in you, and they just need to sprout. So we're looking at research and the researcher's tale that I'll describe. Research is like intellectual capacity, and it then becomes your capital. No one can take this away from you. And once a paper is published, it becomes a permanent seat at the table. There's such a research gap that Africa can fill in the greater scope of the knowledge. We're trying to say, number 1, let's put ourselves out there. We need scientific visibility. Even without the daily machines, your intellectual output is actually world-class, because then by saying out these issues, we're filling out the gap. And this comes with a strategy where you're leveraging the data of the local challenges that contribute to the literature of physics. Medical physics is an interdisciplinary field. It works hand in hand with other people. I like to say our careers are intertwined, they are interdependent, similar to the families from which we originate. So that framework of being a family does not only exist where we come from, but it also sips into our careers. Thereby, we're introducing science diplomacy. The interdisciplinary bridge here is the science diplomacy. The shift is a background in medical physics provides you with a technical lens that is missing in most policy rooms. People understand the vague science of the matter, but when it comes to addressing the real science that's in between, it is you, the medical physicist, who knows and is well equipped to share that knowledge with the rest. Interdisciplinary affairs in the domain of radiation safety in a hospital, that's not where only it is confined. It seeps into other matters like global health security, climate change, and disarmament, among many others. I'll give you an example of insider threats. When we're looking at the framework of a medical physicist, you're working with radiation and nuclear sciences. And what that might mean is you have the radiation source within the facility of a hospital. And if we have an insider threat, someone who's going to use the source out of ill intent, then that causes harm to everybody else. So we're trying to say that as a medical physicist, step out into the global space and speak out for the safe and sustainable use of this material. But in order for you to reach these high places, you need to be a teachable spirit. This is where the power of mentorship comes in. Look for people who are in places that you want to be and let them help you get to those places. Let them mentor you, let them share with you how you can achieve these great spaces. We're saying mentorship comes first by finding your tribe. The field of medical physics is so vast. So you need to get to a point where you can narrow your scope and know how to attain global influence. If you're going to be running with nuclear physics, then be it. Pick out your sport and run with it. It comes also as a collaborative spirit and realizing that mentorship, you then stop being a one-man band. It then becomes this collective effort, turning your individual technical expertise into a global force. Mentorship is a pipeline. When you're mentored by someone, it doesn't end right there when you attain your success. It creates a pipeline of communication where, as an early career physicist, if you're stuck, you can still reach out and ask for help. Last but not least, I will speak on the importance of using your voice, the power of advocacy. Your voice can do so much for the space, and you can share with so many people so that they can be aware of this life-saving specialty. The power of advocacy gives it's like authority versus influence. Yes, you have your degree. Yes, you have the knowledge, but how is your voice going to change? So we're trying to say, let's have dialogue that brings out change out of people, to have the people in our regions acceptable of the knowledge of nuclear and radiation sciences, and not only be thinking of harm, but seeing the beacon of hope that it truly is. The power of emerging technology in today's world, it's life-changing. If you are young, you understand that we're spending most of our time on TikTok and Instagram and a little bit of Facebook. But sharing through these emerging technologies will help the news of nuclear and radiation sciences from the perspective of a medical physicist reach the spaces it's supposed to be. And that way you are known and it transcends even borders. Action, once you've heard, like right now, was encouraging each other to use these platforms. We need to have a platform that serves as a permanent home for these stories that we're creating. And in so doing, I'm so happy to announce to you guys today that in the next few months, I'll also be launching my own podcast to amplify these true tales of medical physicists from a perspective of a young person in Africa. And I'll advise all the medical physicists from Africa who are listening that remember, it's always one step at a time. You will get there. Of course, when we look at the narrative, it's not exactly ideal, but with the work that we're already doing now, we are getting there, and one step at a time. Thank you, everybody, for listening. And if you have any questions, I'll be more than happy to assist. Thank you so much.
Thank you very much, Hazel, for that inspiring speech and presentation. We really appreciate that. And of course, we wish you all the best in this starting journey in your new podcast series. We really wish and hope that you have a large audience on that and continue inspiring many members of the community. So now let's proceed with the Q&A session, followed by Victoria, also a distinguished member of the team. And let me just share some background of Victoria's career before giving the floor to her. So Victoria is a radiation protection expert at the Austrian Agency for Health and Food Safety, focusing on clearance, environmental monitoring, and contaminated areas in radiation protection. She is also a PhD student at the University of Natural Resources and Life Science, Vienna, Austria, where she explores the radiation protection aspects of wood fuel combustion, residues from a radiation protection perspective, focusing on cesium-137 and strontium-90 post-Chernobyl. Victoria is a member of the Austrian Association for Radiation Protection and the chair of Young Scientists and Professionals. Additionally, she is a member of the leadership committee of the International Radiation Protection Association, Young Generation Network, IRPA, and YGN. So, Victoria, please, the floor is yours. Thank you for being today.
Thanks a lot, Florencia, and also to the speakers. Thanks for the good presentations. It was really interesting to also compare how it's working in Europe and how the view is in Africa. We don't have yet any questions in the chat. Is anybody here who wants to ask the question personally? Then you can just raise your hand. While you're thinking about your questions, I have a question. Anna Maria, you presented the mentorship program and also the possibilities for Africans to participate when they are getting a member. Is this mentorship mainly online or does it require to be in Europe?
Yeah, so from what I know is based on the discussion that you have with the mentor and so I guess that it probably could be open to Africans. I think that like the first two rounds that they have happened so far, I think that there were only European participants included. But then, yeah, we might consider in the future if we need to, for example, maybe for the next steering committee in the early career, they might want to establish a collaboration and create a similar program like the mentorship, but pairing Africans and European medical physicists, for example. So that's an idea that maybe we could work on.
That sounds really interesting because also in Europe, there are so many different countries, and when the possibility is with the online participation, it would be great for the Africans. Thanks a lot.
Yeah, and it's not, and it's mainly, I think, through email or online meetings. And of course, it's up to the mentor and the mentee, I guess. If they want to meet physically, they can arrange that. But yeah, it's mainly organized online.
Then, Mohammed, you raised your hand. Can you please turn on your microphone and ask your question? Maybe also shortly introduce yourself, please. We can't hear you.
Oh, a radiation protection specialist, mainly CT imaging and dosimetry. Also, I'm a PhD candidate in Federal University of Lafia, Nigeria, but currently I'm a lecturer in the Kampala International University, Uganda. And I joined the mentorship program for medical physicists. Thank you.
The audio, Mohammed, was not continuously, so we heard your introduction. Is it possible to write your question again in the chat so I'm sure what you asked? Then, before we answer Mohammed's question after he wrote it in the chat, Veronica asked if she can only join the European group if she's a medical physics and has practice in it.
Yeah, so you don't necessarily need to be a medical physicist, but then you need to go through this path that I showed you through individual associate membership. So if you become an individual associate member, NIFOMB, and then you can apply for the membership for the early career.
Maybe Anna Maria, can you post your email address if
Yes,
some
I
of
can do
the
that. Yeah.
listeners have specific
Yeah,
questions
if they
about
have
their
specific
pathway?
questions.
Yes.
Yes, of course.
Then we had the question of Edwin, I think. It goes also to Hazel. Maybe we start with you, Hazel. How, on your perspective, can YGNs like ours move beyond networking to actively shape policy and training standards in medical physics? Anna Maria, Hazel,
Okay.
yeah, now, yes, now
sorry.
we can hear you.
Great. I would say the first step is to have young people involved in what you're doing. Correct, you're already doing that. But the biggest hurdle would be funding, because the people that you're working with cannot afford by their own means to be in places where everyone else is meeting. So an engagement that would be meaningful is to organize funding within the YGN, so that if they have a need for collaborative events in person or something that can motivate young people to stay involved. Thank you.
Thanks a lot. And Anna Maria, what is your opinion?
Yes, I also agree that funding would help. And maybe programs similar to mentorship, as I said, like matching African and European medical physicists, sharing their experiences and information, that could be a good starting point. And then, of course, funding would be very, very helpful.
Thanks a lot. I also think what you presented, Anna Maria, with this online platform where there's accessibility to different education, webinar and training, that's also really great if a network can offer something like that to their members. Because if it's online, you can train and learn from everywhere. So that's a really good opportunity. Sodiq Bello, I'm not sure if I pronounced your name rightly. Can you? Yeah, perfect.
Yeah, hello everyone. Thanks to the presenters and the hosts. I hope I'm loud and clear.
Yes, we can hear you.
Okay, please. I joined the presentation late, so the link to join, as in the link to be part of the member of organization, I couldn't get that aspect very well. And also, is there an email that one can contact in order to ask for more information and how one can be part of the mentees? Because I'm hoping to partner with the organization to learn from the expertise and as well spread my network as well.
Anna Maria already sent the link to the mentorship program in the chat. And I'm also sure if you have any specific questions, you can ask her per email. She also sent her email address. This was also a question from Dennis via chat. I think mentorship programs are huge possibilities for each of the early career scientists, medical physics, and you can learn also so much from each other. So sometimes it's not necessary to really have an old mentor, or maybe we call them senior mentors. But it's also if you have somebody to talk to who maybe is one semester above or 1 year longer in a clinic, that's also a mentor for you, or it can be. So keep your eyes open, as Hazel said, take step by step and learn from each other. Anna Maria, yeah.
Yes, I think I can share my screen and
yes.
show a bit like the information about. So if you follow the link that I have posted in the chat, here you can find some description about the mentorship program. So we get the idea that in order for the mentees, in order to be selected, they send their CV and the motivation letter, and then there is a form that you can click the link and add all the information. And then, as it says here, the selection will be made in terms of personal interest, geographical diversity, motivation, and needs. And then they organize those interviews. And then once the matching process is done, then the mentorship program starts. And it's not like the mentor is not supposed to supervise the work, as it says here, but it's more about sharing, asking questions and sharing experience, and mainly through email. But again, it's up to the mentor and mentee. They might want to schedule physical meetings. This is up to them. They can definitely do that. Yeah, so I think that we can think about organizing, as I said, the mentorship program, but with the purpose of pairing European and African medical physicists. Yeah, I'm not sure. Like I can discuss that with my colleagues in IFOMP, and let's see how this will go. But of course, right now you can, since I think that they are accepting applications, so you can use this link that I posted in the chat and press here and share your CV and give it a try.
Just to clarify, you need to be member of IFOMP to also participate in the mentorship.
Yeah.
And that this is the 15 euros membership fee.
Yeah, but this is if you want to become like an individual associate member. So they have different memberships.
Okay.
This one is mainly it was established in order to gain access to the IFOMC learning platform, but it's open to people from all over the world. So that's good, because then you don't necessarily need to be like based in Europe. So that's why I proposed that one.
Okay.
Because otherwise, like if you want to become, for example, a member for the early career medical physics special interest group, then you either need to belong in a European country that is a member of FIFOMP, or then to do that process through the individual associate membership.
Thank you. Then I would have another question for both of you, Hazel and Anna Maria. What do you think are the foundational skills during academic training somebody should prioritize to succeed in a clinical environment? So can you give any advice for the future medical physicists?
Yeah, I think as Hazel said, like it's very important to not only focus on the scientific skills, but also on soft skills and creating a network. And also, it's a good idea to be exposed in different topics, like to not focus only on one, because you might realize that again, it's not only the clinical workflow. For example, right now I'm working in industry. There are people working in associations, other associations related to medical physics. So it's not only the clinical side that it exists.
Thank you. Hazel?
Thank you. I would say, similar to what Anna was saying, the field of radiation and nuclear sciences has got to be an interdisciplinary affair. If you want to stick out and run with medical physicists alone, and run with medical physics alone, then the scope of what you're going to reach and the people that you're going to cover is going to be limited. medical physics will stretch to various domains. So if you're a young person in medical physics, be open-minded and grow your network. Thank you.
Thanks a lot. And also, I want to, if there are no other questions, I want to finish with a really personal question for you two. So, why did you choose to become a medical physicist? What's your motivation?
Yeah, for me, it all started with physics, and then
Okay.
nuclear physics, and then yeah, during my studies, I did we had this opportunity to do an internship in a clinic, and when I did that time, it was my first time like meeting and shadowing other medical physicists. So I was hooked basically by the clinical practice.
So it shows the chance if you have the possibility to visit somebody and just see how the work is going to learn for yourself if this is something for you. So I think
Yeah,
that's a really nice
exactly.
opportunity.
Exactly. It's always a good idea if you have a hospital nearby that you know that they have a medical physics department, you can try to reach out to the medical physicists working there and ask them, discuss with them and gather information.
And that's like Hazel said, if you grow your network and you know people, for example, in the industry or in a hospital or in the government, just ask them if you can come for a visit, talk to them, see what their work is, and get an experience for yourself what your passion is. Thanks a lot, Anna Maria. Hazel?
Mine is quite an interesting story. After A levels in Zimbabwe, that's when we have our bachelor's degree programs beginning. So I was at a space where I was also deciding which field am I going to settle in. And lucky for me, I got the option to job shadow quite a few professions. And I went for job shadowing and I landed in the radiotherapy center at our local hospital, which is Paranyatwa. And previously, 4 years back, I had just recovered from severe alopecia. So what that meant for me is I didn't have hair, I didn't have eyebrows. It was just so severe. So walking into the ward and I see kids that looked just like me a few years back. And what I remember is being so young and the bullying being so intense. People always told me I have cancer, and I didn't have cancer, but I could see those children with cancer, and it was like a mirror. They look like me. And already with the stuff, the knowledge that I had learned, having learned maths and physics at A level, I was like, I need to get into this field. I need to serve the people that look like me. And that's when it just kickstarted. I looked for the program and I joined the medical physicist. Thank you.
Thanks a lot, Hazel, for sharing this personal motivation. And good that you are better and can help the others. And it's really good to hear that there's the possibility with job shadowing after the A levels. That's awesome. But as I said before, even if there's no program for it, maybe it's possible for you to establish something for yourself so you can do the job shadowing. So reach out, and most of us in the field, we are happy to share what we know. So if somebody is interested and asks, can I come and visit and learn something? Most of us would say, yes, with pleasure. I want to share. So be, yeah, try it out.
Yeah, exactly. I think that most of us would be open, like to help if we have the knowledge, or so. Yeah, ask questions and be open-minded.
Be brave.
Exactly.
Yes.
Yeah,
I,
it goes back to the concept of mentorship we were sharing. Job shadowing is actually a form of mentorship.
mm,
Yeah, and you're not the only one that's struggling. Do not think like that. That's a good suggestion, I think.
Yes.
Everyone has been to that black hole.
We have all different pathways, but the passion is similar, and we love to share our passion, and we want to help you as well. And yeah, so are there any questions from the audience? If not, before we stop the Q&A, if you have any questions after the webinar, please feel free to write to Anna Maria. Hazel, is it possible to also send your email address in the chat? Then if there are any questions for you, the participant can also write to you. And
Okay.
thanks a lot. And I would give back to Florencia.
Thank you so much for this fantastic and interactive Q&A. And, like, all of us will struggle at some point. So never be afraid. And you have to continue the journey no matter what happens, because life has to move on. And what it doesn't kill you, it makes you stronger. So keep that in mind. So now is the time to come to the end of this session today, and let me introduce one of our new members that is taking place in today's session. We have Fadili Konzi from Kenya as well. It's one of the distinguished members of RPNS-YN network, serving as the coordinator of RPNS-YN, a student at Kenyatta University pursuing a degree in environmental physics with a strong passion for youth development and community transformation. Fadili plays a key role in guiding the organization's vision and coordinating programs. As coordinator, Fadili oversees planning, implementation, and ensures that RPNS-YN continues to empower young people and create a meaningful impact. So, Fadili, please, over to you. The floor is yours. Thanks for being here today.
Thank you, Florencia, for this opportunity. Hello, everyone. I hope you're doing good. Fadili Kwanzi, as you heard, the coordinator, RPNS. And on behalf of the organizing team, I'd like to sincerely express heartfelt gratitude to all who made this today's session a success. And first, I'd like to extend appreciation to Edwin Kagai for the welcome remarks and setting the tone for this insightful discussion. And secondly, I'd like to appreciate Madam Florencia Ritendria, sorry for that, the WIN co-leader at Women Nuclear Global, for guiding the session so professionally and ensuring the discussion is so engaging and focused. And special thanks to our distinguished speakers, Anna Maria Fanu. You'll excuse me for the pronunciation of the names, of course, and for sharing valuable insights on medical physics in Europe, and Hazel Rapofazo from Zimbabwe for an enlightening presentation on the challenges and opportunities in medical physics in Africa. We also appreciate Victoria Hasna from the International Radiation Protection Association, Young Generation Network, IRPA. And lastly, to all participants, thank you for your active engagement and thoughtful contributions. Your presence and participation today made this event impactful and inspiring. Thank you all, and we look forward to more collaboration in the future. Thank you.
Thank you very much, Fadili, and thank you for being here and also coordinating those strategic efforts with RPNS-YN. So now, please, Mattia, if you can help us to proceed with the closing remarks, we will appreciate.
Yeah, thank you, Florencia, and thanks to the speakers and to Victoria for moderating the session. But very few words, because a lot has been said. I would say Maybe, yeah, just to reiterate the message that has been delivered so far. So I really invite the audience to stay curious and explore all these opportunities which are around you, around us, around you, to explore the QR codes and the links and the contacts that Anna Maria and Hazel share with you, and to build step by step your future career, hopefully in the medical physics sector, which, as Hazel and Anna Maria highlighted, is a very interdisciplinary field. So actually there are many entry points, there are many contact points among the fields and the subjects. So there are different opportunities, ways, and possibility to enter the sector. And thank you again to all the collaborators and the organizers, of course, for setting up this very inspiring session. And we're looking forward to have a new episode together. Thank you all.
Thank you so much, Mattia, for all your support. And I would like to call also, excuse me, I would like to call also to Margaret, if she can give us some closing remarks for today's session. She has been instrumental also in organizing this program.
Thank you, Florencia, for the opportunity. I just want to say thank you to our speakers today, Anna Maria and Hazel, Rosani. What you've really talked about can help many young people in Africa. For example, the FOMP mentorship, joining FOMP, I believe as young Africans can learn a lot from those in Europe who've been there before them. We appreciate that for sharing that information with the young people in Africa. Hazel, Rosani, you've made an impactful discussion, given us your story. You've talked about medical physics being interdisciplinary, research, how research gives you visibility, how to use your voice. I believe if the young people in Africa across the world can adopt this approach, they can make the world a better place as they promote themselves. Mattia, Florencia, Victoria, we appreciate the role you've played in making the webinar a success. And to Edwin and Fadili, I appreciate for stepping in. I was late, I was in a meeting, and you stepped in and did a marvelous job. Otherwise, thank you all, and I hope we keep collaborating. Thank you so much.
Thank you so much, Margaret, Mattia, Hazel, Victoria, Edwin, Fadili, and Maria, all the speakers, audience that attended today's session. And let me just share briefly the contact points of the organizations. The speakers also share with us their email information also. So please feel free to reach out to us whenever you get a question, or if you think that you can collaborate with us, we will be very happy to do so. So thank you very much for your attention. And before we close today's webinar, we want to have like a picture capture of this moment. I think that'll be very valuable also. And of course, the recording will be available in the RPNS-YN YouTube channel. So I encourage you, all the audience, to follow the RPNS-YN YouTube channel. And more of the episodes will be here. Well, will be there, sorry, in the channel. So please, if I would like to invite you to open your cameras, that we can have a global picture for today's session. And also invite my colleagues if we can capture some pictures together, because I think we are a large audience today. So please, if we can just wait for a few seconds before everyone gets their cameras open. Wonderful. So at the count of three, we have to do it like in separate sets because we have like 5 views. I'm sorry. You can also help me, Victoria, Mattia, to make the captures in parallel. Okay, so at the count of three. 1, 2, 3. So wait, it's just one set. Apologies for that. But we are a big group, sorry. So let's proceed with the second group. So at the count of three, please stay with me. 1, 2, 3. So one last, please. 1, 2, 3. And I'm just ending with the last group. So the last one, please. 1, 2, 3. Fantastic. That's all. So please, Matti and Margaret, over to you. If we are okay, we can end today's session, and thanking all the attendees and the great audience we have today. We hope that you stay with us in more episodes, and we would like to hear from you. Thank you so much. Have a very good rest of your day, depending where you are.
Thank you all.
Thanks
Thank you.
a lot. Bye.